Medical Dilemma.
Welcome back to Medical Dilemma. Again, I'd like to say thank you to our major sponsors, St. Clair's Medical Center in Palanan, Makati, Makati Medical Center, LifeQuest Training and Consultancy Corporation, and its partner Manila Workshops. Now, going back to our discussion on Alzheimer's, Doctora, you mentioned something about sufferers exhibiting a particular age.
Yes.
In terms of memory, I suppose.
Isn't it in Alzheimer's you go retro, your retrograde memory? Is that correct?
Yes, that's true, Doctora. Our memories get erased backwards. No? So it's hard for them to remember what
Recent
they ate
events.
recently, what clothes they wore, or what happened this week versus what happened 40 years ago.
But if they recall, oh, I forgot now. I ate egg this morning, but now later on you recall. Will that be part of Alzheimer's already? Not yet.
Usually, if you really have Alzheimer's disease, it's very difficult for you to recall.
You will not recall.
It's very, very
I
difficult
see.
already.
That's so I was asking is that, for example, you retro back to the age 30, you have a 70-year-old patient and is now acting like a 30-year-old, you know,
yes.
Single, flirting with everyone. Well,
Going out to party.
how about his feeling, her feelings? How would you treat such a patient? Or the family should treat such a patient?
Well, of course, they should still be treated with respect, even if they are not acting their age. And our first rule of thumb is that you should have no conflict. Kumbaga, you just go with it. If they want to dress up and fix themselves, then you go on with it. Really, no conflict. Kasi it breeds aggression, agitation, and restlessness.
And
So
they would really feel hurt also, likewise.
yes, they're actually very sensitive, even to side comments. When they say na, ay, ulyanin na yan. Ganyan. They're very, very sensitive to it. So usually I just term it as a memory impairment or memory lapses, which is true in a sense, but you don't have to say it straight to their face because they're very sensitive.
Or sometimes the family members totally ignore their comments, no? Because they know that ano na nga, ulianin na nga.
Yeah,
So
that's
they should
true.
really be patient with them, right?
They should be patient and they should also be treated with respect.
How about, Doctora, of course, the family members, isn't this also painful for them when they see their loved one suffering or retrograding? For example, sabi mo, like I said, Doctora, for example, you remember yourself 30-year-old single, then you forget your husband. Isn't that also painful for the husband? Hindi po ba? Paano, what do you counsel the family members in that case?
It's really very difficult, no? And no amount of preparation can prepare you for that. No? Kasi you're used to having the mother or the father as the mother figure, and then all of a sudden, they have to be cared for.
Yes.
You have to bring them to the toilet, you have to bathe them. So this is an all-new ball game. Nothing will prepare you for that. But I drop hints every now and then because it's a progressive disease. So eventually, I have to tell the family that this is going to happen in the next few years, and we have to be ready for it. I direct them to useful web pages and websites that they can use to prepare them for it.
So I suppose, you mentioned that such people are very sensitive regarding their feelings. So I suppose they would also be very much exhibiting adverse patterns of behavior.
Yes, this is also the point na sometimes they want to assert their independence.
Yes, yes.
So being also disoriented, this is also the time that they get up at 2 a.m. and think that it's time for work, and they dress up and they go out of the house, and they get lost. And then you see them on TV because they are lost. No? So it's very, very difficult. No?
So is it...
Well, one of the things that probably we have to remember here is, well, while the doctor, for example, is very caring or is focused on the patient, one of the things that probably they can do is also to train and educate the immediate family and even friends, those who are around him. Because if they don't, they might think that, what happened to this guy? He seems to be very different now. He's a different person now. And if they are not educated, they might even, would say, avoid this person. It might be assaulting or might become aggressive or what. We don't know what's going to happen to him. we might also be assaulted, something like that. So
Yes.
what are we going to do? Unless we educate and train these people, also part of the doctor's ethical obligation. I think the doctors owe it to the patient to educate people around him.
Is physically restraining the sufferer a viable or much more unethical intervention in such cases?
No, that is only done as a last recourse if
As
the
a last
patient
resort.
has a tendency to hurt himself. There are many, many ways to go about it. We in the Alzheimer Disease Associations of the Philippines, we want to empower communities by knowledge. We educate the community so that identified patients with dementia can roam around and walk around the
Right.
community freely. And you know, everybody can just keep an eye on them so that they don't get lost. Of course, in North America, they put GPS and they have bracelets, so that's also acceptable because there are lesser people who look after these elderly patients. But at the end of the day, it's really for the paramount interest of the patient. Also, we have what we call medical restraints. Now, we can give them medication so that they won't be too aggressive or they won't be too restless and wander about. So that is also possible. Only when they are hurting themselves do we actually resort to physical restraint, and only for a very limited point.
So-
Yeah, that should be the new norm, Doktora. Maganda yung message ng Alzheimer's Association. Those who suffer from Alzheimer's, for example, or dementia, who roam around, should roam around safely and freely in our communities. For example, the public should know na if there's an elderly person na obviously not in their right mind, temporarily makakalimutan, we should exert all efforts to return him or her safely to their families, not hurt them, for example, guide
ridicule
them.
them?
Yes, same
Oo,
with lost
yeah.
children. It should be a community thing. It should be a nationwide effort, consciousness. Now, when we find someone who is lost, even if they're not suffering from Alzheimer's, that we should exert all efforts to keep them safe and return them to their families.
Right.
It's
Do
just
you
that-
advise bracelets, ID bracelets?
Yes,
where
that's
persons who
always
can be
advisable.
contacted?
Sometimes we have to sew their ID into their clothes or their favorite jacket. So nothing of value, because you know in the Philippines that's a very difficult situation. But we usually put baller IDs, the rubber bracelets. That's very useful for them.
Okay.
I see.
Yeah, instead of
Yeah,
restraining them, di ba? No? I mean, sabi nga ni Doktora, that's the last resort. Pero if they hurt themselves, yeah, maybe that will be advised by the doctor. But to restrain someone, it will amount to illegal detention almost. So we should let them be themselves, no matter what age they're exhibiting. No? Tama yun.
I just wanted to mention that the ideal might be very difficult to achieve in Greater Manila, for example.
Metro Manila, where
That's
you've
right.
got different kinds of people, no?
Yes, and
They are
people
caring, not
really don't
caring.
care. Yes.
There are people who are, mandurukot or something like that, and they will probably
advantage.
treat this person up, pwede itong madukutan. Something like that, no? But if you will be trained enough, no? Especially in school also, already. That when one way or another, we might become one of them. And we will still be safe, even when we are lost.
That's true.
So
what do
an
we depend
ethical
on?
obligation on the part of all of us, and especially the school. Because that's the proper locus where you can, educate people.
Is it all right to commit an Alzheimer's sufferer to an institution or maybe a retirement home? Is that a viable alternative?
Well, it's a cultural thing. Sa Filipinos kasi po, they would rather be cared for at home. Yun po ang norm. Like 95% of my patients are cared for by family members
At
at
home.
home. And only when they cannot do that do they hire a caregiver who is there 24/7. But there are very few na meron po kasi talaga no relative,
Yes.
no friend. So they have to be placed in an institution so that they can be cared for properly.
Well, there are existing hospice cares, institutions, homes. They look like ordinary homes, and they're treated properly there.
Yes, there are.
And these hospices are adequately equipped to take care of such patients.
Well, most of them are. Kaya lang hindi po kasi talaga siya uso sa Philippines, no? Meron po, pero it's not like in the Western world na every street corner, you know, there is a big nursing home. Hindi po ganon. Because the Filipino culture is still to take care of your parents at home.
Well, in the States, there are really institutions like that. When, for example, the children would go to the offices, they would entrust these parents
like
or institution.
Like a
And
daycare
at 5 o'clock,
center.
yes, at 5 o'clock, they will collect them back home.
Oh, you see, I was
And there are
proposing
nurses
that
who take care of
really.
them. And they are given, for example, activities. I've been to many places in California. There are so many institutions like that.
Like
And,
daycare
well,
centers.
They still enjoy, even if they are already have degenerative diseases. And then once they are collected, they are already at home, and the children can take care of them.
Because it's nice really for them to mingle with their own age group, right?
Yes.
I mean, even if they have no Alzheimer's yet.
Yes, that is definitely recommended. Any social activity is good for them. Any physical and social activity is good for them.
Good for them. But
I
do they have to be with the same age group as what they are exhibiting?
Not necessarily. Any
necessarily.
form of social activity. So it's not limited to their age group. Even interacting with their grandchildren or their children is welcome. So we just have to get
For
them involved.
Alzheimer's
Yes, we just
patients.
have to get them involved in activities. So I always tell my patients, lahat ng outing, kasama si Lola, lahat ng kain sa labas, kung kaya nyo rin lang buhatin or dalhin, kasama si Lola.
What do these patients die of in the end, in the final?
Well,
Final
usually it's
moments of their
infection.
lives.
Usually it's infection. They get pneumonia, urinary tract infection. If they are bedridden, they can get bed sores.
I see.
And what is usually done to manage, the end stage of the disease?
Well, at the end stage of the disease, it's really, if the patient is no longer communicative, you can stop the medications for dementia. But some of the families, they want other medications on board, so that's fine for the patient's comfort, especially if the patient is in pain. So we respect that.
I see.
It's a very, very hard disease. What are the statistics now, Doctora, in the Philippines? Do we have a lot of them now?
Yes.
A lot.
Unfortunately, habang dumadami po yung senior citizens natin, dumadami yung likelihood na we will be having Alzheimer disease patients. No?
But-
The baby boomers are getting Alzheimer disease. No? Those who were born after the war, they are now senior citizens. So those are the patients that we screen, and most of them get Alzheimer disease. By the time you reach 80 to 85 years old, half of them will be having memory impairment already. So it has become very common. But of course, we emphasize it's very common, but it's not normal. So they still need to see a doctor, they still need checkups, and they need medications.
I see. So I guess we need to understand, what are the signs that we need to watch out for.
Yeah, what are the signs? that
Of
we-
course, everybody's
watch.
very concerned about that. No? Memory lapses happen to everyone. I think it happens to all of us. We lose our glasses, our
That's
keys,
right,
our
that's
cell
right.
phone, but of
Yeah.
course it goes beyond that. No? You should be able to find it at the end of the day or later on. You should be able to find it or remember it. If it interferes with your daily activities, for example, you cannot keep track of your medications, you cannot keep track of your appointments, you are confused with handling your finances and your money. You cannot handle new appliances or new phones, and you really cannot cope. And those are signs. You cannot travel, you cannot take public transportation, there is no plan B in your head. So those are signs that you have already deteriorated and you really need to see a doctor.
I heard from somewhere that having a computer and doing things on the computer will help you. Is that a fact?
Well, yes, because it increases what we call cognitive reserve. Your network of neurons are increased if you try to do new things. So lifelong learning is something that we advocate. No? Do not close your brain to possibilities. For example, I cannot use this cell phone because it's new. You have no choice. You have to move on. So, because it improves your cognitive reserve. And when you do have Alzheimer disease, this cognitive reserve is something that you can fall back on. These are network of neurons that you can use when the main roads have clogged.
So
Oh my
you can actually regrow or grow new neurons?
It's not impossible.
Yeah?
It's not impossible. And even if the neurons are all there, you can make new connections if you have lifelong learning. So you have to be open to the possibility of learning.
But this is possible only if you have not had the early stages of Alzheimer's yet.
Correct. Correct.
Okay, so while you're young, you might as well continue
Build
studying.
it up. Yes.
Building up a reserve. I see. Okay.
You know, urology is one of the hardest specialties we have in medicine. That's why
okay.
if you're one like that, you have achieved so much already, it's really a big deal. Not like OB and Papa.
Not like OB.
But we earn more? What do you think?
They earn more.
Very well. Well, we have reached the end of our third segment. Maybe if you have any parting words for our viewers, okay, we can start with Attorney Sana.
For me, as I said, the new norm should be, the Philippines should be a safe place for anyone suffering from Alzheimer's. Even if you're a non-sufferer, if you're lost, you should be able to roam freely, safely, knowing that strangers will help you find your way home. So this should be the new normal for the entire Philippines.
Yeah, I agree with that. Okay, Dr. Anlacan.
For me, I think that if you feel that you have memory problems, you should go see a doctor
See
at
a
once.
doctor immediately.
Okay.
Good advice.
Yes.
I'll
yes.
set up an appointment with you tomorrow.
Oh, really?
Father Jerry?
Well, memory retardation can come to us at any time. But one of the most important things that we have always to remember as ethical people is always consider everyone as a fellow human being who needs care, who needs love. And remember, love your fellow man as you love yourself.
That's very nice. Dr.
Very
Sanchez.
important also is that they should be sure that their family are intact even after they've passed away. That's why very important that they are able to donate or at least pinpoint what things they want to give away and to whom. And they must do it according to law. Because if it's not according to law, it's as if you have not done any will at all. And the simplest is the holographic will, but it must be properly dated.
Okay, thank you so much, Dr. Sanchez. Watching a loved one waste away with Alzheimer's disease is certainly a heart-wrenching experience, but one should be most generous in making the sufferer feel that he or she is still a person with dignity that deserves unending love and respect. Thank you for tuning in to Medical Dilemma. If you would like to send questions, comments, or suggestions, please email them to heavenlycrestproductions@gmail.com. Do watch us again next week, 6 p.m. here on GNN for a look at organ donation, to give or not to give. You can also catch us every Monday from 11 a.m. to 12 noon on this same channel. Help patients and families in crisis. Be aware and show you care. Have an enlightened week ahead of you.
Medical Dilemma